Hi, I'm Dr. Salil Patel with Baptist Heart Specialists. I'm here to talk to you briefly about heart disease and to remind you of some of the symptoms that you might have if you do have underlying heart disease. I know that right now everybody's attention is focused on COVID-19, and rightfully so. This is a major worldwide pandemic affecting people across the globe from all walks of life. It's shutting down the economy worldwide, so it is something that we have to pay attention to. But we have to also remember that those disease processes that were there before COVID-19 hit the scene are still present. So common things still occur commonly. Heart disease, for example, is the number one killer worldwide. It was like that before COVID-19 hit the scene and most likely will be so going on into the future. So with that in mind, there are several things you have to remember about heart disease and some of the symptoms. So the classic depiction of somebody with a blocked artery or coronary artery disease is a chest tightness or chest heaviness in the center of the chest. Sometimes people feel like there's a band around their chest or there's a bricks or an elephant sitting on the chest. Some of these symptoms can radiate across the chest. They can radiate to the neck and the jaw. You can have discomfort in your arms. Those are all signs of classic description of coronary artery disease. These symptoms typically occur with exertion and are better with rest. So if they start to occur with less and less exertion or with minimal exertion and even at rest, then that could be a sign that things are getting severe. Some people may not present with the typical chest tightness or chest sensations, but they may rather have shortness of breath. Sometimes people, as they get older, develop more shortness of breath symptoms. Again, these symptoms are typically worse with exertion and better with rest. Shortness of breath can also be a sign of underlying congestive heart failure, and that's usually associated with some signs of fluid overload like weight gain or swelling in the legs. Sometimes people have difficulty breathing when they're lying down. Those could be all signs of fluid overload and congestive heart failure. So it's important to remember these symptoms, and if you have any of these symptoms, to really bring them to the attention of your doctor. I know right now we're practicing social distancing, but many doctors out there are able to see patients on an urgent basis, and they're even able to communicate with patients via online platforms or via video conferencing. So even though we're trying to minimize exposure, there's still ample opportunity to be able to communicate your symptoms to your doctor and see if anything further needs to happen from that point on. Remind you all to be safe. So thank you.